What is Donepezil? Donepezil is a medication used to treat the symptoms of Alzheimer's disease, a progressive neurological disorder that affects memory, thinking, and behavior. It is also known by its brand name, Aricept. Donepezil is classified as a cholinesterase inhibitor, and it works by increasing the levels of a neurotransmitter called acetylcholine in the brain. Acetylcholine is involved in cognitive functions such as memory and thinking. By inhibiting the breakdown of acetylcholine, Donepezil can temporarily improve cognitive function, behavior, and the ability to perform daily activities in some individuals with Alzheimer's disease. It doesn't cure the disease, but it can help manage its symptoms. Donepezil is typically prescribed as a tablet or orally disintegrating tablet, and the dosage may vary depending on the individual's condition and response to the medication. It is important to use this medication under the guidance and supervision of a healthcare professional, as they can determine the appropriate dosage and monitor for any potential side effects. Common side effects of Donepezil may include nausea, vomiting, diarrhea, and insomnia. Pharmacokinetics. Pharmacokinetics refers to the processes the body undergoes with a drug, including its absorption, distribution, metabolism, and excretion, ADME. For Donepezil, absorption, Donepezil is well absorbed after oral administration. Peak plasma concentrations are usually reached within 3 to 4 hours. Distribution, Donepezil is highly protein-bound, about 96%, and primarily distributed in the plasma. It has a moderate volume of distribution, indicating that it is mostly confined to the blood. Metabolism, Donepezil is metabolized in the liver, primarily by the enzyme CYP3A4 and, to a lesser extent, by CYP2D6 and CYP3A5. It forms metabolites, but its primary active metabolite is 6-O-desmethylDonepezil. Excretion, the metabolites of Donepezil are excreted in the urine and, to a lesser extent, in the feces. The half-life of Donepezil is approximately 70 hours, allowing for once-daily dosing. What is the mode of action of Donepezil? Donepezil's mode of action is primarily related to its role as a cholinesterase inhibitor. It works by increasing the levels of a neurotransmitter called acetylcholine in the brain. Acetylcholine is a chemical messenger that is involved in various cognitive functions, including memory, thinking, and learning. In individuals with Alzheimer's disease, there is often a deficiency of acetylcholine in the brain. Here's how Donepezil works. Inhibition of cholinesterase enzymes. The brain naturally produces acetylcholine, but it is broken down by enzymes called cholinesterases, including acetylcholinesterase. Donepezil is a reversible inhibitor of acetylcholinesterase. This means that it attaches to and temporarily inhibits the action of the enzyme. By doing so, Donepezil allows acetylcholine to persist in the synapses, gaps between nerve cells, for a longer time. Increased acetylcholine levels. With the action of acetylcholinesterase reduced, acetylcholine accumulates in the synaptic cleft. This increase in acetylcholine levels can enhance cholinergic neurotransmission, which is crucial for cognitive processes. Temporary improvement in cognitive function. By maintaining higher levels of acetylcholine, Donepezil can lead to temporary improvements in cognitive functions, including memory, attention, and problem-solving abilities in individuals with Alzheimer's disease. These improvements can help manage the symptoms of the disease. It's important to note that while Donepezil can provide symptomatic relief and temporarily slow down cognitive decline in some individuals with Alzheimer's disease, it does not cure the underlying causes of the disease. The effectiveness of Donepezil varies from person to person, and the duration of the improvement in cognitive function can vary as well. The medication is typically used as part of a comprehensive treatment plan for Alzheimer's disease. Effect on cognition. The increased levels of acetylcholine in the brain can temporarily improve cognitive function. This is particularly beneficial in individuals with Alzheimer's disease, where there is a deficiency of acetylcholine. Symptomatic relief. Donepezil does not alter the underlying course of Alzheimer's disease but may provide symptomatic relief, including improvements in memory, thinking, and the ability to perform daily activities. Dosing considerations. The dosing of donepezil may need to be carefully adjusted to balance therapeutic effects and side effects. Some individuals may start with a lower dose, example, 5 mg, and may be increased to a higher dose, example, 10 mg, after several weeks. Donepezil's pharmacokinetic and pharmacodynamic properties make it a valuable treatment option for managing the cognitive symptoms associated with Alzheimer's disease. However, it's important to use the medication under the guidance and supervision of a healthcare provider to optimize its therapeutic benefits while minimizing potential side effects. In what strengths donepezil is available? Donepezil is available in several different strengths to allow for individualized dosing. The most common strengths of donepezil tablets are 5 mg and 10 mg. The appropriate strength and dosing regimen for an individual can vary depending on their specific medical condition, tolerance, and how they respond to the medication. Typically, the treatment starts with a lower dose, such as 5 mg daily, and may be increased to 10 mg daily after a certain period of time, as determined by a healthcare provider. It's important to follow your healthcare provider's instructions and not adjust the dosage without their guidance. What are the indications for the use of donepezil? Donepezil is primarily prescribed for the treatment of Alzheimer's disease. The indications for the use of donepezil are as follows. Mild to moderate Alzheimer's disease. Donepezil is indicated for individuals with mild to moderate Alzheimer's disease. It may help improve cognitive function, including memory, thinking, and behavior, and may enhance the ability to perform daily activities. Severe Alzheimer's disease, off-label use. In some cases, healthcare providers may prescribe donepezil off-label for individuals with severe Alzheimer's disease. While the primary indication is for mild to moderate cases, it may be considered in certain situations. It's important to note that donepezil is not a cure for Alzheimer's disease. Instead, it is used to manage the symptoms of the disease and may provide temporary relief from cognitive decline. The medication is typically part of a broader treatment plan that may include other supportive therapies and interventions for individuals with Alzheimer's disease. The decision to use donepezil and the appropriate dosage should be determined by a healthcare professional based on the patient's specific condition and needs. What is the prescribed dosage for donepezil? The prescribed dosage of donepezil can vary depending on the individual's condition and response to the medication. Generally, the dosing regimen for donepezil in the treatment of Alzheimer's disease is as follows. For mild to moderate Alzheimer's disease, the typical starting dose is 5 milligrams, once daily, usually taken at bedtime. After several weeks of treatment, the dose may be increased to 10 milligrams once daily. If the patient tolerates the medication well and if it is deemed appropriate by the healthcare provider. For severe Alzheimer's disease, off-label use. In some cases, healthcare providers may prescribe a higher dose, but this is less common and typically decided on a case-by-case basis. It's crucial to follow the prescribed dosage and schedule provided by the healthcare professional. Do not adjust the dose on your own, as the dosage may need to be titrated to minimize side effects and optimize effectiveness. Additionally, donepezil is usually administered in tablet form, and there is also an orally disintegrating tablet available for those who have difficulty swallowing pills. The healthcare provider will provide guidance on the appropriate form of the medication. Dosage instructions. Always consult with a healthcare provider for specific dosing instructions, as they will take into account the individual's health status, response to the medication, and any potential interactions with other drugs. Regular monitoring is essential to assess the medication's effectiveness and to manage any side effects that may occur. Is donepezil combined with other drugs and under what conditions? Donepezil is sometimes prescribed in combination with other drugs or treatments, depending on the individual's specific needs and the stage of Alzheimer's disease. These combinations may be used to address various aspects of the disease or to manage associated symptoms. Some common combinations and conditions include donepezil and memantine. Memantine is another medication used in the treatment of Alzheimer's disease. It belongs to a class of drugs called NMDA receptor antagonists. In some cases, healthcare providers may prescribe a combination of Donepezil and memantine for individuals with moderate to severe Alzheimer's disease. This combination may help manage different aspects of the disease by working on different neurotransmitter systems. Donepezil and supportive therapies. In addition to medications, individuals with Alzheimer's disease often benefit from a range of supportive therapies. These may include cognitive and behavioral therapies, physical exercise, and social engagement. Combining Donepezil with these supportive interventions can enhance overall care and quality of life. Treatment of comorbid conditions. Individuals with Alzheimer's disease may have other medical conditions or symptoms that require separate treatment. For example, if someone with Alzheimer's also has depression, anxiety, or sleep disturbances, medications specific to those conditions may be prescribed alongside Donepezil. Pain management. Some individuals with Alzheimer's disease may experience pain due to conditions such as arthritis or injuries. Pain management medications may be used in conjunction with Donepezil to address this issue. The decision to combine Donepezil with other drugs or treatments should be made by a healthcare provider, based on a comprehensive assessment of the individual's health and specific needs. It's important for the healthcare provider to consider potential drug interactions and monitor the patient's response to the combined treatment. Always consult with a healthcare professional for guidance on the appropriate treatment plan for Alzheimer's disease. And discuss any concerns or questions you may have about medication combinations and their potential benefits and risks. What are the side effects of Donepezil? Donepezil, like all medications, can cause side effects. Not everyone will experience these side effects, and some individuals may experience them to a greater degree than others. Common side effects of Donepezil may include nausea. Nausea is one of the most common side effects of Donepezil. Taking the medication with food, particularly at bedtime, may help alleviate this symptom. Vomiting. Some individuals may experience vomiting, especially when they first start taking Donepezil. Diarrhea. Diarrhea is another gastrointestinal side effect that can occur. Insomnia. Donepezil may lead to difficulty falling asleep or staying asleep in some individuals. Muscle cramps. Some people may experience muscle cramps or muscle weakness. Fatigue. Fatigue or tiredness can be a side effect for some individuals. Loss of appetite. A decrease in appetite may occur in some cases. Headache. Headaches are a less common side effect, but they can still occur. Dizziness. Dizziness or lightheadedness may happen, especially when standing up quickly. Bruising. Donepezil can increase the risk of bruising or bleeding in some individuals. It's important to note that these side effects are often mild and transient. Additionally, not everyone will experience these side effects, and some individuals may not experience any at all. If you or someone you know is taking Donepezil and experiences side effects, it's important to inform a healthcare provider. They can help manage side effects and make necessary adjustments to the treatment plan. In some cases, side effects may be temporary and improve with continued use of the medication. However, if any side effects are severe or bothersome, it's important to seek medical advice promptly. Additionally, if there are signs of a severe allergic reaction, such as difficulty breathing, hives, or swelling of the face, lips, tongue, or throat, seek immediate medical attention. What are the contraindications for the use of Donepezil? Donepezil may not be suitable for everyone, and there are contraindications or situations where its use is discouraged or should be carefully considered. Contraindications for the use of Donepezil include allergic reaction. Do not use Donepezil if you have had an allergic reaction to it or any of its components. Signs of an allergic reaction may include hives, difficulty breathing, or swelling of the face, lips, tongue, or throat. Severe liver disease. Donepezil is metabolized in the liver, and individuals with severe liver impairment may be at increased risk of side effects. The medication should be used with caution or avoided in such cases. Prior hypersensitivity reactions. Individuals who have previously experienced hypersensitivity reactions to cholinesterase inhibitors like Donepezil should not use this medication. Asthma or chronic obstructive pulmonary disease, COPD. Donepezil may exacerbate symptoms in individuals with asthma or COPD, so its use should be carefully considered in such cases. Stomach ulcers or gastrointestinal bleeding. Donepezil may increase the risk of gastrointestinal bleeding, so it should be used with caution. In individuals with a history of stomach ulcers or gastrointestinal bleeding. Cardiac conduction abnormalities. Individuals with certain heart conditions, such as sick sinus syndrome or atrioventricular (AV) block, may need to use Donepezil cautiously because it can affect heart rhythm. Seizure disorders. While Donepezil is generally considered safe, it should be used with caution in individuals with a history of seizures. Pregnancy and breastfeeding. The safety of Donepezil in pregnant or breastfeeding women is not well established. Healthcare providers should carefully weigh the potential benefits and risks in these situations. It's important to discuss your medical history, including any pre-existing conditions or medications you may be taking, with your healthcare provider before starting Donepezil or any other medication. They can assess whether the medication is appropriate for you and provide guidance on its use. Additionally, any potential contraindications and precautions may vary based on specific individual circumstances. So it's crucial to consult with a healthcare professional for personalized advice. What should I watch for while using this medication? When using Donepezil, it's essential to monitor your condition and be aware of any potential changes or side effects. Here are some things to watch for while using this medication. Cognitive and behavioral changes. Pay attention to any changes in memory, thinking, or behavior. Note if there are improvements or any new difficulties in these areas. Side effects. Be aware of potential side effects, such as nausea, vomiting, diarrhea, insomnia, muscle cramps, or any other unusual symptoms. If you experience bothersome side effects, consult your healthcare provider. Dosage and medication schedule. Ensure you are taking the medication as prescribed by your healthcare provider. Follow the recommended dosage and schedule. Do not make changes to your medication regimen without consulting your healthcare provider. Allergic reactions. If you develop signs of an allergic reaction, such as hives, difficulty breathing, or swelling of the face, lips, tongue, or throat, seek immediate medical attention. Interactions with other medications. Be vigilant about potential interactions with other medications you may be taking. Inform your healthcare provider and pharmacist of all the medications, including over-the-counter drugs and supplements, to prevent adverse drug interactions. Symptom progression. Keep track of any changes in your Alzheimer's disease symptoms. This may involve discussing your condition with your healthcare provider and assessing whether Donepezil is effectively managing your symptoms. Regular medical checkups. Continue with regular medical checkups and follow-up appointments with your healthcare provider to monitor your condition and response to treatment. This will help your provider make any necessary adjustments to your treatment plan. Medication supply. Ensure you have an adequate supply of Donepezil to prevent interruptions in treatment. It's advisable to refill your prescription in a timely manner. Caregiver observations. If you are a caregiver for someone taking Donepezil, closely monitor the individual's condition, especially if they have difficulty communicating changes in their symptoms. Report any significant changes to their healthcare provider. Driving and safety. Be aware of how Donepezil may affect your alertness and coordination. Some individuals may experience dizziness or other side effects that can impact their ability to drive or operate heavy machinery. Remember that the effectiveness and side effects of Donepezil can vary from person to person. It's crucial to maintain open communication with your healthcare provider. Report any concerns or changes in your condition, and follow their guidance for the best management of Alzheimer's disease. Does any precautions required while prescribing Donepezil due to drug interactions? Precautions are necessary when prescribing Donepezil due to potential drug interactions. Donepezil can interact with other medications, which may lead to adverse effects or altered medication effectiveness. Healthcare providers should carefully assess a patient's current medication regimen and consider potential interactions before prescribing Donepezil. Here are some precautions to take regarding drug interactions. Cholinergic medications, combining Donepezil with other cholinergic medications, such as other cholinesterase inhibitors or certain drugs used for glaucoma, may increase the risk of side effects and should be done with caution. Anticholinergic medications. Medications with anticholinergic effects, which reduce acetylcholine activity, can counteract the effects of Donepezil. These medications are often used to treat conditions like Parkinson's disease or overactive bladder. Combining Donepezil with anticholinergic drugs should be carefully considered. Certain psychiatric medications, drugs used to treat psychiatric conditions, such as antipsychotics and tricyclic antidepressants, may have anticholinergic properties and could interact with Donepezil. Combining these medications should be done cautiously. Certain antibiotics. Some antibiotics, such as erythromycin and clarithromycin, can interact with Donepezil and may increase its blood levels. The combination should be monitored closely. Antiarrhythmic medications. Certain antiarrhythmic drugs may affect heart rhythm. Combining Donepezil with these medications may require careful monitoring. Nonsteroidal anti-inflammatory drugs, NSAIDs. NSAIDs, including ibuprofen and naproxen, may increase the risk of gastrointestinal bleeding when used with Donepezil. Warfarin, a blood-thinning medication, can interact with Donepezil, potentially affecting blood clotting. Dosing adjustments and monitoring may be necessary when these medications are used together. Other medications. There are numerous other drugs that may interact with Donepezil. It's crucial for healthcare providers to review a patient's complete medication list to identify and address potential interactions. To minimize the risk of drug interactions, it's essential for healthcare providers to review the patient's current medications, including prescription, over-the-counter, and herbal supplements. Consider the potential benefits and risks of combining Donepezil with other drugs. Adjust dosages or choose alternative medications when necessary. Monitor the patient's response and any potential side effects closely. Patients should inform their healthcare provider about all the medications they are taking, including non-prescription drugs, supplements, and herbal products, to ensure safe and effective treatment with Donepezil. Additionally, healthcare providers may consult drug interaction databases and resources to make informed decisions about medication combinations. What are the popular brands of Donepezil available? Donepezil is available under various brand names, but the most well-known and commonly used brand is Aricept. Aricept is the brand name for Donepezil hydrochloride. It is available in different strengths, including 5 mg and 10 mg tablets. While Aricept is the most recognized brand, generic versions of Donepezil are also available under different brand names. Generic Donepezil is typically labeled with the active ingredient, Donepezil, followed by the manufacturer's name. The availability of specific brand names may vary depending on your location and the pharmaceutical companies operating in your region. Some popular generic brand names for Donepezil include Donepezil, by various manufacturers. This is the generic name for the medication and is widely available. Memac, by Torrent Pharmaceuticals. Memac is a brand of Donepezil manufactured by Torrent Pharmaceuticals. Donecept, by Cipla. Donecept is a brand of Donepezil produced by Cipla, an Indian pharmaceutical company. It's important to note that the active ingredient in these medications is Donepezil, so the therapeutic effects should be similar regardless of the brand you choose. The choice between brand and generic forms may depend on factors such as cost, availability, and personal preferences. When considering options, it's essential to consult with your healthcare provider or pharmacist to make an informed decision.